Module 1, Foundations of Epidemiology. Lecture 1, Introduction to Epidemiology. Welcome to this course on Principles of Epidemiology and Public Health. Epidemiology is often called the cornerstone of public health. It is the study of how diseases occur, how they spread, and what factors influence their distribution in populations. The ultimate aim is to use this knowledge to prevent disease, promote health, and guide health policies. Epidemiology examines not only diseases but also injuries, health behaviors, and risk factors. It provides the scientific basis for decision-making in medicine and public health practice. Lecture 2, Types of Epidemiological Studies. There are two main categories of epidemiological studies, observational and experimental. Observational studies are those where researchers observe events without interfering. These include descriptive studies and analytic studies such as case control and cohort studies. Experimental studies involve intervention by the researcher, such as testing a new drug, vaccine, or prevention program. Each study type has its strengths and limitations. Observational studies are useful for generating hypotheses, while experimental studies are better for establishing causation. Lecture 3, Basic Measurements in Epidemiology. Epidemiology relies on precise measurements. The most important are incidence, the number of new cases of a disease in a population over a given time. Prevalence, the total number of cases, both new and existing, in a population at a given time. Mortality rate, the frequency of deaths in a population. Risk and odds, measures used to compare likelihood of disease between groups. These measures allow us to understand disease burden and to evaluate the impact of public health interventions. Lecture 4, Observational Epidemiology, Descriptive Studies. Descriptive epidemiology answers the questions, who, where, and when. It describes disease distribution according to person, age, sex, occupation, place, geographic region, environment, and time, seasonal or historical trends. These studies often use routine data such as census records, hospital records, or surveillance systems. While they cannot prove causation, they provide essential clues about risk factors and help prioritize public health action. Lecture 5, Observational Epidemiology, Case Control Studies. Case control studies compare people with a disease, cases, to those without the disease, controls. Researchers look back in time to assess whether exposure to a suspected risk factor is more common among the cases. These studies are relatively quick and inexpensive, making them suitable for studying rare diseases. However, they are prone to recall bias, since participants may not accurately remember past exposures. Lecture 6, Observational Epidemiology, Cohort Studies. Cohort studies follow groups of people over time to see who develops a disease and who does not. They can be prospective, starting in the present and moving forward, or retrospective, using past records to follow outcomes. Cohort studies are powerful for identifying risk factors and estimating disease incidence. However, they are time-consuming and costly, especially when studying diseases with long latency periods. Lecture 7, Experimental and Interventional Studies. Experimental epidemiology involves deliberate intervention, such as assigning participants to receive a treatment or a placebo. The classic design is the randomized controlled trial, or RCT. Such studies provide the strongest evidence for causality. They are used to test vaccines, drugs, and preventive measures. Despite their strengths, they can be expensive, ethically complex, and not always generalizable to larger populations. Lecture 8, Screening in Epidemiology. Screening is the early detection of disease in apparently healthy individuals. Examples include screening for high blood pressure, cervical cancer, or tuberculosis. Good screening tests must be sensitive, able to detect disease when present, and specific, not giving false positives. Screening allows for early intervention, often improving outcomes and reducing healthcare costs. Lecture 9, Investigation of Disease Outbreaks. Investigating outbreaks is one of the most practical roles of epidemiology. The steps usually include confirming that an outbreak exists, verifying the diagnosis, defining and identifying cases, describing cases by person, place, and time, developing and testing hypotheses about the source, implementing control measures, communicating findings. Outbreak investigation helps to contain disease spread and to prevent recurrence. Lecture 10: Basic Demographic Methods. Demography is the statistical study of human populations. It provides essential context for epidemiology by describing population structure, growth, and change. Key measures include fertility rates, number of live births per woman, mortality rates, number of deaths in a given population, life expectancy, average number of years a person can expect to live. Demographic data allows us to calculate disease rates accurately and compare populations over time. Module 1 Summary. In this first module, we covered the foundations of epidemiology, its definition, study types, and key measurements. We explored observational studies like descriptive, case control, and cohort designs, as well as experimental studies. We also examined the role of screening, outbreak investigation, and demographic methods. These principles provide the essential tools for studying diseases in populations and for designing effective public health interventions.